Hello, welcome to my channel. My name is Katrina. I am a nurse, a energy healer, and I specialize in mental health, substance use, and trauma. And I've done nursing for over 20 years. And recently I just started this YouTube channel. So I'm getting myself out of my comfort zone. I'm moving into an independent practice, and this is part of the teaching piece that I wanted to add to my service. Yeah, so I come on here and I talk about different things that have come up for me, maybe in the day, or different practices to support nervous system regulation, which in turn supports our mood and our ability to just show up in the world as we'd like to show up as our authentic self, which feels better from my experience. It's hard wearing all those masks. It's exhausting. And I recently just started this, and it really has put me outside of my comfort zone. So it's a good thing. I don't know what's going to happen with this, but yeah, I will never disclaimer. Recently, just today actually, someone sent me a message saying someone reached out saying that they were me, and they asked to click on a link. I don't ask people for money. I don't ask people for I won't reach out to you asking for money or asking you to click on a link. And yeah, so this is my only channel, and yeah, I hope that doesn't keep happening. I understand why it happens. People are desperate, but yeah, that's not the energy I want to bring to this channel. So today I thought I would talk about connection being medicine. So maybe you've heard that before about connecting with others. We can't heal in isolation. However, and I'm speaking from experience, if you've ever been depressed or socially anxious and isolating, and I've experienced all of that, it's super hard to be around others. And I'm a nurse, and at one point when I was within the trauma piece of my injury, the traumatic stress injury that came with depression, panic attacks, social anxiety, the whole shebang, it was really challenging. One of the triggers was being around other nurses, and it didn't matter who they were. It was like, if they were a nurse, it was just, that was what my nervous system said was scary, and it would go into that survival, fight, flight, freeze, fawn response, and it was really challenging. So I get it when people say like connection is medicine. So what really supported me was learning how to regulate myself around others again, slowly bringing myself out into the public, supporting, just even going to the grocery store. Like, that in itself was a challenge. I can remember that. It feels so far away, but I do remember that being a challenge. It was hard to be in public, even people I didn't know. And people I knew even, right? So that co-regulation that happens first with us, right? So if we come into a situation, if you've ever come into a room and you can feel, like, you can see there's two people sitting there and you can feel something's off. It's like maybe just, moments ago, the two of them had a disagreement and the energy in the room is off, right? So that's our nervous system and our ability to sense energy picking up on something, right? And yeah, so it is challenging if you're like have an injury for one, and you're dealing with you know, an injury within the nervous system, or you're dealing with mood challenges and like depression, social anxiety or anxiety, and yeah, to support that regulation. It can be done though. So that co-regulation. Okay, so I'm going to show you this one resource I have. I love this book. It's really good for teaching. But it's a polyvagal flip chart, and it's called Understanding the Science of Safety, and it's by Deb Dana. Love her stuff. It's really like has really good. So if you ever want to teach this to anyone else, or you're curious, like great resource. So yeah, love it. And there one part in here is talks about co-regulation, and here it says, right, is it safe to connect? So that is our nervous system asking when we come into a place or a situation, or you know, we're going into work, or we're going to a grocery store, or it's like, is it safe to connect with people, right? The autonomic nervous system will send and search for cues of safety and or danger, and that's, you know, a natural process that happens with us, right, as humans, as animals. And you know, there's that drive to survive in like the world that we live in, right, which might be activated more if you've been listening to the news, or you know, in access to in the vicinity of things that, you know, cause activation within our nervous system, continuous stress on our system, acute, chronic, you know, that moral distress we deal with in some of the jobs that we work, or, you know, so many things, right? Childhood trauma, different things like that, ongoing trauma through our life. And then there's this longing to connect, right? So it could be, you know, really wanting to connect with others, but we're really struggling. So sometimes those two things can get us to that place where we will push ourselves, right? Or it might be like opposing. So our nervous system might be telling us something that's really not true. And, you know, for instance, that our friend Joe Blow, you know, really thinks poorly of us in some way, and they don't want to hang out with us. And who would want to hang out with us anyways, like me? And, you know, if, you know, we tell ourselves that's those stories, right? And then it just keeps us in that isolation, keeps us in that loop, keeps us in that drive to survive, anxiety, fear, worry. You know, it's like those pathways within our brain that have been paved. So it's like slowly, surely paving other pathways, getting out of those, you know, routines of not going, and getting ourselves out of those, our comfort zone, right? And yeah, so the autonomic nervous system, the other thing it talks about on this chart is it's both shaped and regulated through interactions with others. So if we set ourselves up with, say there's someone out in the world that is just a beautiful soul, and they just make you feel so good. So when I was in that place, I have a beautiful friend, and she called me. She's known me for years, since like grade 7, I think it was. And she said, "You're not coming out to the function, you know, our social events. Like, what's going on? There's something going on with you." So she called me out, right? And, you know, I told her what was going on, and then I started to, you know, she was giving me that motivation, right? Sometimes we need that external motivation. So that's why it's okay to tell people that we love and trust, we know won't judge us, to be like, hey, like, I'm having trouble. You know, I'm feeling all these things. And, or, you know, we reach out to that therapist that really knows about trauma, if that's what's going on for you, or mood stuff, right? and we get that support that we might need to get out of this funk, right? So putting ourselves first in that way as well. You know, I talked about boundaries. Did I talk about boundaries? I might not have talked about boundaries. I will talk about boundaries if I haven't yet. And that, you know, boundaries can be another thing that can support us in this place, especially, you know, telling people close to us that, you know, I can only do this much because this is where I'm at right now. And, you know, asking again for help and support. Yeah. So when we are able to co-regulate, so say I'm walking in and I'm going to go see my friend who called me and said, I know you're not doing well, you haven't been showing up to our social functions and you know, whatever it might be. It's like, and she's like, I'm going to come over for tea, and even that was like, you know, nerve-wracking, right? But just allowing yourself to be open to that and practicing that over time, your nervous system is going to recognize that you are going to be safe in situations with people that you know are safe, right? And you continue to do that until you can get the trust back, and like, you know, you're going to be okay, even if that person over there isn't, you know, okay, right? So it just takes practice to get back into that and out of that isolation, which causes us to stay, you know, depressed, causes us to stay in the cycles of anxiety and depression, right? So a little bit of what they call behavior activation is like pushing ourselves a little bit more, right? Just to move ourselves out of that space, but knowing that it's okay to be around others, and then practicing that regulation of like, okay, I'm okay, you know, the cognitive it's a cognitive behavior therapy with some mindfulness, right? Like speaking to yourself, keeping yourself present with breath, and you know, recognizing what's going on and allowing that process, you know, the RAIN that I talked about, the RAIN mindful exercise, and whatever the you know, it could be distress tolerance skills, or using something like the 5, 4, 3, 2, 1, where we use our senses. We get out of our mind and we get ourselves into our body. If you know, that's something that supports you. It's just like finding out what are the things that really do support you to be continue to connect with others and to stay regulated. And the beautiful thing about this is, and what I noticed as I healed, was that when I stayed regulated and I stayed within my window and my window of tolerance, and I was able to, you know, not react, I was able to respond to whatever was coming at me, then those around me, be it my children, my husband, my friends, strangers, also felt more grounded. They also felt safer, right? And more, yeah, just kind of like mirrored each other's internal states. So yeah, it's kind of a neat thing. And as you practice it more and more, you become more and more aware of it. So co-regulation, look up, there's so many videos on it. But again, this is looking at the polyvagal theory and nervous system, and yeah, it's something to practice and to support your relationships going forward. Okay, I hope that helps. Just a little tidbit on co-regulation, and that connection really is medicine. Sometimes it just takes a little bit of practice to get back into get back to connecting with others, and just push yourself a little bit, just a tiny little bit, get back to connecting with others. Okay, take care. Hope this is supportive. Bye.